Excited that you can be here. I want to thank a lot of people that helped make this event come to be. And most importantly, as I said, this is an important event because mental health is important. It doesn't get enough venture funding. It doesn't get enough attention in the business sector, and we need to change that.
I'm Heather Aton. I am the Chief Innovation Officer at Dudnick Health. And I feel like having a role like this at a healthcare marketing and communications company is innovative in and of itself. We are very excited to be a sponsor of this event. It's a bit of an experiment for us.
Figuring out how to leverage these technologies, digital technologies, to address a growing problem and challenge that we have as a society around mental health and mental illness is really important, where I found in the research that I've been doing in this area as a part of the Digital Mental Health Project that there is not a lack of applications that are being worked on, but very often what we have is a lack of adoption and scale up of these applications.
We've seen that A, depression is this incredibly big problem, B, there's a treatment that's known to work, but C, people don't get this treatment. So how do you solve this problem? Our solution is Uplift. It's a complete depression treatment program on your smartphone. Can therapy actually be computerized? That's a big claim. Well, we have a big answer to that claim, which is there have been 19 randomized control trials studying computerized treatment for depression. These are actually the results. It actually really works. It's
pretty much the vast majority of those who are psychiatrically challenged are cigarette smokers. 46% of all cigarettes bought in the United States are bought by somebody with a psychiatric disability. How does IntelliQuit work? Well, the individual smokes, obviously, and via expired breath, they blow into the IntelliQuit device, and that transmits those results wirelessly via Bluetooth. But that's not all.
The first piece, of course, is the screening, and we're working with SMH to bring their platform into our offering. The second piece is positive psychology coaching. And of course, positive psychology is a study of happiness, what makes us happy, and how to be more resilient in our lives. And we think this is so essential these days. So we want to take what you see in products like Happify and CoachMe and put that into our platform, build our own types of tests, gratitudes, goal setting, and those kinds of activities into our platform.
The total market size, 1.6 billion potential users with anxiety disorders, specific types of phobias, fears, and a huge possibility here.
Partnered with the University of Southern California. They've done clinical studies. It's exceedingly effective. And as Alan said, we're working with a couple very, very large community mental health centers in the United States to roll this out.
So I believe that we can use mobile gaming as a platform to help treat depression. We can do so by making the first step towards treatment a lot easier. We can provide early access to support and assistance, and we can collect a huge amount of data that can be used for further care. We embed therapy lessons in meaningful, emotionally truthful stories. In doing so, it makes it a lot more accessible to people.
Talk to people, and I'm like, yeah, so I run this organization. It's called I'll Go First. They're like, what? And I'm like, I'll go first. I will go first. So it becomes this like almost experiential time for both the person I'm talking with and myself, you know. But so I'll go first. So hey, share what's on your mind, and then we'll connect you with services that can help you. Because we know that we can't always be the emergency services for somebody. That really needs to be people who can be on the ground and assist them immediately. We can provide online access to mental health. So CBT, positive psychology, trauma-based therapies, social-emotional learning. We're actually partnering with the Yale Center for Social Emotional Learning, and we're partnering with the Allender Center.
And our winner of the Mental Health Digital Innovation Challenge $10,000 prize is SciAS, virtual reality. All right, and so Alan Goodwin will be accepting.
Okay.
And then Anthony.
Congratulations, Sias. We're going to award you $10,000 check in cash and prizes. Okay, so we're thrilled that you won, and we think you have a great opportunity. And we want to thank our sponsors who put all of this wonderful effort into this event.
Really good business cases, and I'm going to tell you, and I'm sure others in the room agree with me, that we're so appreciative as a community. What I'm going to actually coin us the digital mental health community. For the work that you guys are doing, the business models you're putting together, and look forward to continuing to be in touch with and working with each of you as you continue to prove your business models in the marketplace and scale them.
Faith, keep going, keep demoing, keep selling. Let's change this healthcare world for the better, okay?